Welcome back, everyone. It's time for this week's Medical Moment. In tonight's Medical Moment, we're taking a look at the safety of coronavirus vaccines for pregnant and also breastfeeding mothers.
We are joined today by Dr. Mimi Munn, who is the head of the Department of Obstetrics and Gynecology at USA Health. Dr. Munn, thanks so much for being with us. Let's start with pregnant women. Is it safe for people who are pregnant to receive this vaccine?
Yes. Thanks for having me to deliver this important message. Yes, the American College of OBGYN and Society of Maternal Fetal Medicine have come out and strongly recommend that pregnant women and lactating women get the COVID-19 vaccine because thus far the data is very encouraging that this is safe to do in pregnancy.
All right, so let me ask you this. If you're pregnant and you get COVID, talk about the dangers of that. Is it a more serious situation than non-pregnant women?
Yeah, absolutely. That's another reason that we are discussing this with our pregnant patients is that we do know that if a woman has COVID, that has the virus during pregnancy, that they have a much higher risk for adverse outcome and more often will end up in the intensive care unit, on a ventilator, and even have a higher risk of death if they contract the virus. So that's why, again, very important to consider that vaccine.
And what about people who are kind of believing a lot of these rumors about fertility? If I get the vaccine, it will protect my fertility. You probably hear that 100 times a day.
Yeah, at least 100 times. Yeah, this is something that sort of bubbled up on the internet right after the vaccine rolled out, and it was never based on any, scientific data. There was a comment made that maybe the spike protein that the antibody is made against looks like a placental protein, and that turns out not to be true. And thus far, again, with data accumulating about the vaccine in pregnancy, we have not seen an increased risk for miscarriage or any fertility problems in women.
All right, and very quickly, doctor, for nursing mothers, no risk to the baby?
Right. So far, data is very encouraging, have not seen any problems in the babies. And as a matter of fact, it appears that antibody is present in the breast milk, which is very encouraging because we think it may confer immunity to the baby. So very good news.
Very good news. Dr. Mimi Munn, thanks so much for being our guest today.
Now.